Thank you all for joining us. So welcome everyone. I hope you all are doing well today and having a great Wednesday. Thank you for joining us this afternoon for our webinar called Making It Easy to Take Medicines as Prescribed. That's a long word. So I'm going to say it again, making it easier to take medicines as prescribed. Our webinar today is hosted by the Epilepsy Foundation and is with support from our sponsor, Azuri. We are going to talk all things medication adherence and how to make it as easy as possible to take medicines as prescribed by your providers. My name is Shell Lessington, and I am the Community Engagement Specialist here with the Foundation, and I am super excited to moderate today's webinar and be here with you all today. So before we get started and before I introduce our amazing speakers for today, I wanted to first do some quick housekeeping. And while I am doing this, I would love for you all, if you haven't already, put where you are located right now. I am currently in Houston, Texas, and I just love hearing where others are around the nation. So definitely put that in the chat at the bottom of the screen. But quick housekeeping, there will be time at the end for us to go through question and answer. So your questions are very welcome and encouraged. So please submit your questions via the Q&A function at the screen, at the bottom of your screen. And if you can't find it, just definitely let us know, and we'll make sure that we can make sure you find it on your screen. This webinar is being recorded and will be available on our YouTube channel along with our other past webinars. So when you get done with this webinar, definitely go to our YouTube page and subscribe and like and do all the things on YouTube. And lastly, please, we're going to have a feedback survey at the end of this webinar. And it's super important to let us know how we're doing, what we're doing really well, what we're not, and just what other topics you would like to discuss during these type of webinars. So I just want to have those quick housekeeping before we get started. But now on to our speakers. Today, we will have 3 dynamic speakers here to talk you through really what the definition of medical adherence is and what it really means. Also to talk through some common challenges and barriers of why it is so difficult to take medications, and then provide easy things to do and tools to improving taking medications. We'll have an array of different speakers who will talk through their personal journey, provide medical insight, as well as have some time to answer some questions. So today we are joined by Dr. David Ficker, neurologist at the University of Cincinnati Neuroscience Institute, Jessica Veach, Community Operations Manager at the Epilepsy Foundation, and Scott Bazik, patient advocate and peer educator who also works closely with Ellis, our learning health system. Super excited. Thank you all for being amazing speakers. So as we were getting our slides and everything together, and I'm excited for everybody to hear your presentations. Dr. Ficker, we will get started with you.
Excited to be here. I was asked to speak about medication adherence as related to epilepsy from an epilepsy provider perspective. So I am a neurologist that specializes in epilepsy, have been at the University of Cincinnati for over 25 years. So I have lots of patients, lots of patient experience. And over the years, I've been learning more and more about medication adherence and tools and things that we can do to help with our patients adhere to their therapy. So next slide. I first want to start off with what medication adherence is and what it is not. So adherence is not the same as compliance. Medical or medication compliance is a term that is really fallen out of favor. And it really focuses on what the provider, quote unquote, tells the patient to do, what we're doing with your treatment. It's a care plan is determined by the provider alone and implies that there's patient disobedience when not followed. In contrast to adherence, that's defined as the extent to which the patient's behavior aligns with clinical decisions that were made together, both by the patient and provider. This encompasses freedom of choice and does not, imply that the patient is disobedient for some non-adherence. And so adherence is much more than just taking medications as prescribed. And over the years, through a number of studies and in our clinical experience, we've learned that there are many barriers that can impact medication adherence, some of which are not under the direct patient's control. And we'll talk about those in a little bit later. Unfortunately, barriers to medication adherence are relatively common in epilepsy. Studies have shown that in pediatric patients that it's approximately 40%, and similar numbers in adult patients. So anywhere between 30 to 60% of our patients have challenges with adhering to their medical therapy. Adherence or barriers to medication adherence are relatively common, and unfortunately that can lead to less than desired outcomes in our treatments with epilepsy. So challenges with medication adherence, which might include missing medication doses or getting medication late or not being able to get that medication from the pharmacy because of insurance issues, can lead to increased seizures. There's been some studies to suggest that mortality, the chance of dying related to seizures, is increased in patients who have challenges with adherence to medication. Sudden unexpected death in epilepsy is medication adherence, or challenges to medication adherence, has been shown to be a risk factor for SUDEP. The challenges with medication adherence can lead to inaccurate clinical decision-making by the healthcare provider. An example might be a patient goes to the emergency room for a seizure. A blood level shows that the anti-seizure medication level is low due to some adherence challenges, and that dose may be mistakenly increased because of basically treating the lab value, and that can result in side effects from a higher dose of medication. Similarly, if there's medication adherence issues and seizures continue in the presence of medication adherence, that particular medication may be assumed to be a treatment failure when the true reason is really adherence issues. And a number of studies have shown that there's been increased healthcare expenditures, including increased hospitalization rates and emergency room visits related to challenges with medication adherence. So providers really should be assessing for barriers to medication adherence at each visit. And one should note that they can change from visit to visit. So, a visit, 3 months ago, there might be challenges with remembering to take medications, where the next visit, the barrier might be that the pharmacy was out of stock of that medication for a few days and the patient was unable to get that medication. So these barriers can be in flux and can change from visit to visit. And patients and families should be honest about discussing any barriers that they might be experiencing with their medications with the provider, with their healthcare provider team, and possible solutions can be explored. And we'll talk about some of those from a provider perspective in a bit. We have been using this questionnaire in our patients. This is a barriers to medication adherence in epilepsy questionnaire that we're giving to all of our patients in the clinic and assessing for whether patients have barriers to medication adherence, and if so, what are they and what can we do to address them? And so this survey came from the Epilepsy Learning Health System, which Shell had alluded to before. This is a group of epilepsy centers across the country that are looking at improving overall care of patients with epilepsy and looking at quality improvement initiatives to improve our outcomes with our treatments. So you can see here that it's not just I take my medications as prescribed. There are other challenges, which include things like medicine tastes bad from a pediatric perspective, hard to swallow, side effects, concerns about taking too many medications, running out of medications, challenges with scheduling of the medications and getting in the way of other activities, challenges with affording the medications, and insurance issues. So there's a whole host of potential challenges that get in the way of taking medications. So using this survey, this is what we have found in our practice at University of Cincinnati. The most common barrier that's been reported is trouble remembering medications. That is, forgetting to take doses of medications, for example. So roughly 30% of patients who report challenges or barriers to medication report this as the most common one. And we'll talk about that in the next few slides. But other things include side effects of medications. The medication doesn't always work or control my seizures. And then there's some other issues as well, pharmacy-related issues, running out of medications, difficulty getting to the pharmacy, et cetera. So next slide. So I do want to focus on some of these more common challenges. And we'll first focus on remembering to take medications. And we'll hear from Jessica and Scott as well, some of the tools that they utilize and have counseled others in doing to help with remembering to take medications. So, Much of our epilepsy medications require multiple doses through the day. That is, sometimes 3 times a day, 4 times a day dosing. Some patients take more than one seizure medication. So that adds complexity to the medication regimen. And so that alone has some challenges. There's data to suggest that adherence improves with fewer doses of medicine given throughout the day. So, twice a day medicine shows improved adherence compared to 3 times a day or 4 times a day. We do know that having epilepsy is associated with memory difficulties, in that makes remembering to take medications a bit more challenging. And again, be honest with your provider about any challenges that you might have, or that your child or family member may have with remembering to take medications. And we can work with our patients to come up with some options to help with tools to help with remembering to take medications. And so these are some of the things that I've seen in my practice with talking to patients, and from a provider perspective, things that can be potentially done. One is, can the medication regimen be simplified? Does the medication really need to be given 3 times a day? Can it be given once a day or twice a day? Again, it depends on the medication. There are some medications that are available in extended release formulations that are sometimes covered by insurance, and that can help improve adherence from moving to multiple times a day to once a day dosing. It's oftentimes helpful tying that medication dose timing to something else you do every day, like brushing your teeth. I take some prescription medications. I take them in the morning. I take them when I brush my teeth. I brush my teeth at night. You can take nighttime medicines when you go to bed. Sometimes visual reminders are helpful. That could be Post-it notes that are posted in different places in the house. One of my patients told me he actually, in the morning when after he takes his medications, he flips his bottle upside down. And so when he goes, back into the bathroom or wherever he keeps his medication bottle, he sees it's flipped upside down. He knows he took his morning medication. At nighttime, he flips it right side up. And so there's visual reminders that individual use. Pill boxes are helpful. And sometimes if it's a complicated medication or regimen, it may be helpful to have someone double check that. Are the doses for the week, set out appropriately? And don't be afraid to ask for help. Family members, friends, spouses can be helpful reminders to assist you in taking your medications. Have them send a text message, at a certain time each day, checking or reminding you to take your medications. And then lastly, there are some technological tools that we can use. Many of us have smartphones with phone alarms. You can set specific alarms or reminders through the day to take your medication. It might be helpful to change that alarm tone to something different that's unique, different than, let's say, a text message that you get, or the ringtone that you get when you get a phone call, for example, that it's unique and it's specific to your medications. Both Siri, Alexa, and others, you can just ask Siri to set a medication reminder for a specific time each day, and you'll get that alert each time every day. Or if you have a smart speaker at home, an Alexa speaker, you can ask the smart speaker to set a medication reminder. And then there's a number of smartphone apps out there that can be used as medication reminders as well. Next. Let's talk a little bit about side effects. Definitely, as we've seen, the presence of side effects can be a barrier to taking medications. Unfortunately, all of our medications have potential side effects, and they're variable depending on the individual taking the medication and the specific medication. Common ones include fatigue, dizziness, sedation, nausea. Some seizure medications have negative effects on mood. Sometimes can be improved with dose adjustments. If we have someone on a higher dose of medication and they're sleepy or dizzy, we can decrease that dose potentially, hopefully without impacting seizure control. Many times after first starting a new medication, these type of side effects can develop, but typically get better over time. So the longer that individual is on that dose of medication, those side effects improve. Sometimes taking medications with food may help with some of these side effects, particularly in the morning. I've had a number of patients who are on pretty good doses of seizure medications for seizure control, but they take their morning medication on an empty stomach. They can have more dizziness, more sleepiness, and that can be improved with taking that medication with your breakfast at the time you take food. There are definitely more serious side effects with some medications, like a rash, that definitely should be reported to the provider immediately, and that medication may need to be stopped. But I encourage not to stop or miss doses of medications because of side effects. Please discuss that with your provider prior to adjusting your own doses of medication so that the side effects can be addressed and improve that particular barrier. Next. Let's look at pharmacy issues. And these, unfortunately, have become much more common in my experience over the years. These include some of our anti-seizure medications are not commonly prescribed, and the pharmacy may not always have that medication in stock. So at the time you call for your refill, the medication may take a couple of days to come in. And so you definitely work with your pharmacist to see if that medication can be, if you can ask for that refill a few days in advance to ensure that that medication is in stock. Some medications require insurance prior authorization. That is, that the insurance company has to do a review to make sure that that medication is quote unquote appropriate. Although, you could argue that if the provider decided that it was appropriate, it should be approved, but that's a whole different issue. But definitely you want to plan ahead for refills so that if there's a PA that needs to be done, it can be done in time. And generally these unfortunately take a few days. The insurance companies tend to operate on their own schedule and don't necessarily take the urgency of that need to get that medication, in a timely fashion into account, unfortunately. Sometimes we need to do an appeal. That is, the provider might need to do a direct discussion with what's so-called a peer-to-peer review or write a letter of medical necessity. And that unfortunately takes even more time than a typical PA. So it's best to plan ahead. So when when your medication refill is due, to work with your pharmacy ahead of time to ensure that these things can be done and you get the medication approved in time. Some of our medications are controlled substances that they have been labeled by the DEA as potential for abuse. These include a whole number of them that include lacosamide, clobazam, among others. And sometimes the pharmacy will only refill those on the exact day the medication is due. Unfortunately, they're treated potentially like drugs of abuse because they have that controlled label. And this can be particularly a problem if a PA is also needed. And so it's best to have a discussion with your pharmacy and your provider about how to best get that medication filled and approved on time. With having a epilepsy clinical practice, I've gotten calls on a weekend when a patient needs to have a refill authorized on their medication. It's best to plan ahead and check, whether you need refills authorized by your provider ahead of time. You do it a couple of days in advance to help with timeliness of approval. And then, unfortunately, patients with epilepsy may have transportation issues because they can't drive, or they may rely on a family member to get them to the pharmacy. And just to be recognize that some pharmacies do deliver medications. And that was really I think an issue that kind of was, or a solution that came forth from the pandemic. Many pharmacies started delivering medications in the pandemic, and some of those have continued. So if you have difficulty getting to the pharmacy, explore with pharmacies that may deliver medications. And then be sure to work with your provider if you've had any problems getting your medications. I've had situations where I've seen the patient in the office and discovered at that point in time, maybe a month later, that there were challenges with getting that medication, and the patient or family didn't contact the provider office asking for assistance in getting their medications in a timely fashion. Next. Let's talk a little bit about cost of medications. So unfortunately, many of our anti-seizure medications are costly. Many of them are covered by insurance, but some, as mentioned, may need a prior authorization. And the epilepsy providers I know and work with definitely will work with a patient in pharmacy on getting that medication approved. If there are, insurance issues where, there is no drug coverage, there are ways to save on medications. So that includes using generic formulations if possible. And there's increasing evidence from clinical studies in epilepsy that generics are indeed equivalent to brand name versions in the vast majority of cases. GoodRx, and there are other discount codes and coupons that can be used on medications. And interestingly, sometimes the GoodRx cost may be cheaper than your copay, depending on your insurance, and it's definitely cheaper than the normal cash price. So a GoodRx, you can go to the website goodrx.com and type in your medication and get what the GoodRx price would be. And then there's patient assistance programs out there where pharmaceutical companies will look at the individual's income and ability to afford medications, and oftentimes will provide that medication at reduced or no cost to the individual. Next. So this is my final slide, and I really the take-home point is, please be honest with your provider on any barriers that you might be experiencing with your medication. Please don't be embarrassed to discuss them. We've heard a lot of them, and so we can work with you and your caregivers on removing or improving those barriers. And also reach out to other patients. Scott will talk about things that he's done, but support groups are helpful in discussing with other patients on what they do to help remember to take their medication. So there's resources out there. Please reach out to your provider or other patients or the Epilepsy Foundation. We'll hear later the helpline, but those are ways to get help with removing barriers to medications. Thank you.
Thank you so much, Dr. Ficker, for your informative presentation and for giving us a perspective from a provider and a neurologist. And the takeaway is don't be afraid. Don't be afraid to say that there is a barrier or anything that you're going through, because there definitely is a solution to whatever that barrier is. Next up, we will have a presentation by Jessica Veach, who is our Community Operations Manager here at the Epilepsy Foundation.
Hello, welcome everyone. Thanks for joining us today, and thank you, Michelle. Yes, I'm the Operations Manager for the Epilepsy Foundation. I've been on staff 11 years and live in Seattle, and I started having seizures when I was 19. As most epilepsy patients, you try a lot of medications, and it takes a while to find an effective one without side effects. And so once I did find that medicine, I knew I needed to take it just as prescribed. But as Dr. Ficker mentioned so well in his presentation, there are multiple barriers to adherence. And so I know forgetting to take your medication is, you saw on his slide there, one of the main ones. In my case, it was actually forgetting if I had taken it already. It was such a habit that, each morning I would stare at the bottle on the counter and say, oh, did I take it already? And you can't, keep that morning separate from every other morning in the past. So what I found helpful is the night before, I lay out my medication in a little cup on my counter in the bathroom. And so in the morning, I can take it. And then if there's ever a doubt, did I take it or not? You look in the little dish and it's empty. So just, it's similar to a pill case, but that's a way that has been working for me. And then another issue I've had in the past is insurance. So I'm allergic to the generic version of my medication. So each year I have to get a letter of necessity from my neurologist, and she always gets it in and it always works out. But I do have to, just think ahead, put a little more time, effort into the process to make sure I don't run out of medication. And these are just two of the barriers that I've dealt with over the years. But, obviously, as we've discussed, there are many more. So I've been involved with the learning healthcare system that we've mentioned for several years now. And as a patient family partner of that, we saw the need to address these barriers. And so we decided to come up with a toolkit. And so as a group, we made a list of these common barriers. You saw the survey that the physicians are giving out to their patients. And then we went barrier by barrier and came up with practical solutions to help with each. So on the slide, you can see now these are just 2 pages out of our toolkit that we created. And so just as people with epilepsy need to pinpoint their seizure triggers as a way to control their seizures, I think it's really helpful to pinpoint any barriers to medication adherence you might be facing, and then, use this toolkit or talk to patients, other patients, a support group to come up with ways that, creative ways, whatever works for you. And then even just looking at that list that we have shown a couple times, you might not have realized those were barriers you were facing. But just as you step back and pinpoint your triggers, kind of just take a minute to pinpoint any of these barriers. And so even if, the most important thing obviously is taking it as prescribed. So even if it tastes bad or it's a hassle to cut the pills in half, Also, as Dr. Ficker kept mentioning, don't be embarrassed, don't be ashamed, think you're doing something wrong. Just talk to your physician about maybe getting a different dose or ways to make it taste better. And, also things like costs, there's ways to, work around that, and transportation. As he said, they've been delivering more and more pills. And then obviously, with technology and all the ways to help you remember. And right, I just think obviously we all know it's important not to just take your medication, but to adhere to the exact prescription for, your safety and wellness, but then to also use this toolkit or use other support systems to find ways to, overcome your individual barriers. So that is all I have to share.
So really quick, Jessica, I just have a question. Just thanks for sharing your journey, but were you always just very comfortable when there was a barrier? Like when you realized that like you actually had an issue with like remembering to take it, did you feel comfortable talking to your provider? Was there somebody else at the practice that you felt more comfortable about? Or was it just, you knew there was something wrong and you just talked to your provider about it?
Eventually I just, knew that this was something that I needed to follow through with. When I was 19, it's not really your first priority. So it took a couple years to get into a routine and everything, and, have my mom remind me and have my parents help, okay, it's time to renew your prescription. But just as time went on, finding easy ways that, I was comfortable with that were effective.
Gotcha. That was my only question. Thank you so much again for sharing your journey. We are going to move to our last presenter, Scott Bazik, who is a part of Ellis, and he will also talk about his personal journey with medication adherence and any barriers that he may have. Scott.
Hi, thanks, Shell. Again, Scott Bazik. I've been living with epilepsy since 2005, and I live in Loveland, Ohio. So, you've listened to Dr. Ficker speak and tell you, hopefully come up with a medication. If you're newly diagnosed or you're new to your physician, you've met with them and your clinician feels like they found a medication that's best suited to address your seizure situation. And then you heard Jessica speak about a toolkit that the Epilepsy Foundation has been working on to help you stay. After listening to Dr. Ficker, I almost said compliant, to adhere to taking your medication. And that actually is a very good thing to point out there, that terminology can kind of throw people off. But so now we're at the point where the rubber meets the road and you have your medication. You've tried to come up with a plan with your clinician to best come up with a strategy that works best for your situation to maintain the best quality of life, living with your epilepsy and taking your medication. And one thing that I've learned over the past 18 years is that people living with epilepsy are like snowflakes. There's no two patients that are dealing with this the exact same way. We have different types of seizures. We take different type of medications because we react to different medications in different ways. And working with these as a peer educator and working in support groups, you might have one medication and line up 10 different patients, and we all react to that medication differently. Some the medication will work for, some we have different side effects. So it's a very big challenge for the doctors to match that patient with that perfect medication that's going to control their seizures and maintain a low amount of side effects. So one thing that I had to find out over my journey was what type of patient I was. What tips from the toolbox would work for me? Am I good at journaling, for instance, keeping track of things? What's my comfort level with technology, with using phone apps? And most importantly, do I have a support system in place to help me achieve these goals of being adherent with my medication? So for me personally, it was a challenge up until 2005, when I had my first seizure. I hadn't taken anything stronger than Tylenol, maybe for some back pain. So I was never used to being on a medicine that might have some side effects that I had to maintain a certain schedule with, and that going off that schedule might be detrimental to my health. And to be perfectly honest, the side effects were brutal at first. I hadn't been used to experiencing things like that. I've tried quite a few medications over the years, and all with different results and severity, whether, of side effects or with the control of my seizures. But there's one thing that I had to keep in mind through this entire journey is that the medication being prescribed to me from my doctor was really judged to the benefit of taking it was greater than the risk of the side effects. And I guess if I didn't make sense in saying that, if I don't take this medication, I will have seizures, and I could have, a lot of problems down the road, of being hurt or something as a side effect to it. So I just had to accept the fact that side effects were part of the equation to this whole thing. And I just had to balance what I was comfortable with, the amount of side effects with taking this medication. One consistent problem after starting on seizure meds and having seizures, I had problems with my concentration and memory. And I started off taking medication multiple times during the day, had a young family, crazy schedule, and I found myself not being able to concentrate and stay on my routine. I was missing meds. I had made an ER visit, breakthrough seizures, had very strong seizures. And so I had to sit down with my wife and try to come up with some better ways to work with my new lifestyle. As far as some of the things that Dr. Victor talked about using technology, I'm the type of person where my phone is going off every few seconds with some type of alert, email, text message, alarm, whatsoever. So that wasn't really working for me. I found that it became background noise, and it wasn't helping me personally to become adherent on my schedule. So we actually came up with a low-tech solution, and a lot of people that I work with over the years, just your basic pill box and day of the week pill box. So anybody in my family can look in there and say, oh, Tuesday morning, Dad or, Scott forgot to take his medicine. And for me to also be able to look in there and as a reminder. And as I'm filling that in week to week, I can see how my level of medication, if I'm getting low, if I need to call in that refill, because they never stock it at my pharmacy. So it always takes a couple days to get it in. And it helps me keep track of that. Also, and these are very inexpensive things, but you can pop out a day if you're going out someplace and you're definitely not going to be home at the time you take your meds. It gives you a little bit of flexibility. Also, another big thing, and I've seen that it's been very successful for people, is tying in taking your medication with your routines. I'm a big coffee drinker, so there's something I'm always going to have in the morning is my cup of coffee. So this particular pill box is right next to my coffee maker. So it really helps me to remember to take my meds where it's sitting in the house. My nighttime meds are sitting right next to where I brush my teeth and have my nightly routine. And that has been great for me. It could be an eyesore in the kitchen. You might not want to see this ugly pill box out, especially when people come over, but it's a necessity for us. The only time where I will throw in a caveat, as being a creature of habit and being in a routine, when we get thrown out of the routine is probably the one time where I do use technology, meaning, let's say I wake up in the morning, I'm walking down for my cup of coffee and the dog needs to go out, there's some distraction. I will use my Alexa app and say, hey, Alexa, set a 40-minute timer for my medication. So I know when I get back, it will go off as my backup. And that was an idea of my wife's that actually worked out great, because the only times where I found I was having trouble remembering was when I was being taken out of my normal routine. So using that Alexa app or using a timer to get me back on track really did help me. When I was initially diagnosed, I found for maybe the first couple years, it was an amazing help to me to keep a seizure journal. I would track my seizures, the side effects of my medication, which was very important, and anything else that I thought was important to my particular situation. So I could document this stuff. When I went in to speak with my neurologist, I would sort of have a layout of these are the side effects I'm having. And this is sort of when they're kicking in. For instance, I was taking, as I said earlier, in my journey, taking multiple seizure meds during the day, and I was missing doses and, cutting pills, and Lamictal tastes terrible when it's cut. It's got that bitter taste to it. So things that would annoy me, I would bring up to my doctor. And one thing that my doctor and I spoke about was there's an extended release for Lamictal. And that sort of at the time helped my problem, because I went from taking it multiple times to only having to take it one time in the morning when I woke up, as soon as I woke up. And I found that made it much easier for me. And I also had to be very cognizant of the fact of when my seizure side effects kicked in, medication side effects kicked in, because I knew my worst side effects started about 20, 30 minutes after taking them. So my doctor and I found that taking it right before I went to bed was the best time, because the worst of my side effects were the next 4 to 5 hours. So I would sleep through the majority of my side effects. And it made, even though the side effects are not fun, it made it easier for me to be more adherent to being on that schedule. And I've met and worked with hundreds of people who have been in this same boat of trying to figure out this great balancing act of controlling their seizures and taking their meds on a regular basis. But I feel like the most successful patients that I've met have been ones that have been proactive with their care. And what I mean by that is they have a good relationship with their clinician, meaning they feel it's easy to speak with them. They bring in, if they have notes, like I would bring in journal notes or something like that. I had one person tell me every time I go to the doctor, it's like being called into the principal's office, because I'm going to have to, tell them that I forgot to take the medication, or, this and that. And that's not how you should feel. You should feel, if you can have an honest relationship with your doctor, you go in and you say, I did have a seizure, but I missed a couple of these doses. It helps that doctor to realize, well, it might not be a dosing issue, like Dr. Ficker said earlier. It just might be, we have to get him on a proper routine where he's being more adherent, taking his meds, and then he'll be more successful at controlling his seizures. And it can really be that simple, because if you don't have that open communication and that honesty with your care team, you might start making changes to your medication that really will not help with your situation. Also, another thing that I've found that's been very useful, or the people that I've met who develop a good support system at home with their family or caregiver. And when I say that is, if you have a supportive wife or somebody that can back you up on this, taking your meds and keep track of it. I had my kids on top of me as far as making sure that I was taking my meds. It really does help. And if you don't have that, caregiver or somebody that does not even live with you remotely. Met some students who transitioned to college age life, and their parents would help them stay on a seizure, a medication routine remotely through an application on their phone, because they would take their medication and they would mark it in their app. If they did not mark it in their app, their parents would get a message, and then the parents could then give them a call and say, hey, you didn't mark it in your app. Did you take your meds? And it would help them maintain a consistency of taking those medications on a regular basis. And every situation is different. And you also have to be cognizant of the fact that situations change and you have to adapt and pivot and change your strategy. So those are just a few of the things that have helped me and others over time. I hope that's been helpful, and I welcome any questions from Shell or anybody else.
Thank you, Scott, so much. There were so many takeaways from all three of our guests, but I'm gonna try to sum it up, and you all let me know if I missed anything. But number one, making sure that you aren't afraid to talk to your providers or anyone in your clinic about if you are having challenges. Number two, using resources that you do have and using things that you already worked really well with, your routine and adding your medication into that routine. And then number three, Scott, I think you said it, like just also knowing what type of patient you are and knowing what you need and what you don't. I really love that. And I think that was like pretty much summed up all of what we said. I do really quick want to go, Jessica, we did talk about the medication adherence toolkit, but I think I may have left out this actual slide. And this slide, actually, Jessica talked a lot about what was in the toolkit, especially like those 2 pages, but these are other topics that are in this toolkit. We definitely want you all to take a look at the toolkit. There are a lot, I'm not gonna go through the different topics, but addressing the cost, like Dr. Ficker said, remembering to take your medication, taking anti-seizure medication in public. We didn't even touch on that, but the toolkit does. And so I wanted to make sure you all know that there were other topics in this toolkit, and would love for you all to take a look at it. So now we have time for Q&A. I will take a look at the question, the chat box, to see if there are any questions. Also, I want to open up the floor. I want to open it up to everyone who's on. Thank you all for being on and listening to our presenters. I hope that they pretty much laid out exactly, any questions or thoughts that you may have had about this topic. But if there are any other strategies or any other resources that people would have used to help them take their medication, I want just to come on in the chat so we can all have them and share them back. I know Jessica and Scott gave a lot, but just wanted to see if anybody else in the audience wanted to share any other resources that they had that could be helpful for others on the call. So I have a question coming in from John. Thanks, John, for your question. So is the 30% of people who forget to take their medications only people responsible for their own care, or does it also include caregivers responsible for their loved one's care? That's a good question. I think that's for Dr. Ficker, but I'm going to say that question one more time just so I can make sure that I understand. So is the 30% of people who forget to take their medications only people responsible for their own care, or does it also include caregivers responsible for their loved one's care?
Yeah, great question. That 30% number really is not just the remembering to take medication, but it includes all the other barriers as well. But that encompasses both the individual, but also caregivers. That might include, parents of a child with epilepsy as well. So it's not just the individual provider, but it's sort of the entire sort of medication administration and medication acquisition process.
John, I hope that answers your question. Faith Lynn, she said medication reminders and timers. We talked about that. I also wanted to just put this to the presenters and just see what you guys' thoughts are. But say if I am a patient that I am on multiple medications and I'm just having a hard time remembering, and I really don't have a lot of support at home, and I'm afraid to talk to my doctor about it or anybody in the practice, what type of resources or what would you suggest for a patient like me? Because I'm sure there are patients who are having these barriers, because we know there are, but they just are maybe afraid to kind of talk about it or say that they are having issues, and don't really have like family to talk about it or friends. And that's a deep question, but I think that's just a question that, we should think of. I always think about the big picture. We got to think about that because we know those are the problems, right? But like, what are the solutions for a patient like me per se, or others who may have those same concerns?
I think that's where the Epilepsy Foundation and the affiliates can help, reach out to, the helpline is, and Shell's going to share that in a little bit, but that's a great resource that can hook that particular individual up with, tools that might be helpful for that particular individual.
Yep, I was going to say that. I was giving it to you all as a question, but I was going to say the Epilepsy Foundation has that helpline where you can talk to somebody about any other issues, either other than medication adherence. I am going to talk about that later, but there are resources out there because this is an issue. So I say that to whoever the patient that it may be, is that if there are concerns, there are issues, there are resources or people that you can trust, that you can talk to, especially here at the Epilepsy Foundation. All right, let's see if there are any other questions. This is a question from Nick. Thank you so much, Nick. How should parents of children with epilepsy help their child take meds when the child does not like to or want to? So Scott, you talked a lot about your journey, but what about kids? And Jessica, I think you talked about it too in the toolkit, but just suggestions from any of the panelists.
Yeah, I don't treat pediatric patients, but I was looking at the that Jessica had the making medications easier to take was really an interest, coating the medication in the, the Hershey's ice cream shell and making it chocolate flavored was brilliant. There's some other techniques there that are in that toolkit that I think are worth exploring.
And we do have using motivation to help you take your medication is one of the pages of the toolkit. And so, you could make it a game, make it different rewards involved or things like that to help your children.
We have a question from Samantha. Again, thank you, Samantha. I think it's more about, about in pediatric and children, but how can we properly enforce a reminder without making them feel like they're being forced or babysat? Or let's say an individual is very much down and about their diagnosis and feel their medications won't help and driving away from taking them. How can we properly enforce them? And I think, Samantha, I think that's a question of, figuring out the resources, figuring out what type of, like going back to what Scott said about what type of patient the patient is and what they will need. And if it is hard to reinforce that, then it's going to be a lot of motivation from, the caregiver or the provider. I think it's just a lot of just reminders about how important medication is. And Dr. Ficker talked a lot about that, but making sure you're medically adherent just really helps, throughout the whole process and your whole journey, and just making sure that people know that, the better you feel, like medication can make you feel better. That's just those were my thoughts. Those were directly from Shell, not from anybody else.
I think also from and I presume this being forced or babysat question might relate to teenagers maybe with epilepsy, but having an open and honest conversation with that child or teen with epilepsy that we're not nagging you, we're a team, and I've taught and Scott and I've talked about this before in our quality improvement work, is that it's a team approach, that it's great to have a support team, that individual, don't go through it alone, work with your loved ones, friends, families, and it's important to be accepting of the diagnosis and sit down with that child that feels like they're being nagged and talk about the reasons why that these reminders are important and why medication adherence is important. I don't know if Jess or Scott have any other comments on that one.
We talk a lot about this at our epilepsy camps for kids here in the Cincinnati area. And it depends on the age of the kid, obviously. But, the younger the child, the parents try to usually tie that with a positive connection. Like it might be a nighttime snack and you sit down and they get to watch their favorite show and they watch, they take their meds as a part of it, tie it into something positive and not just, okay, come down and take this medicine and go right to bed or something like that, maybe ease them into it. But yes, it is a common thing for not only teenagers, for grown adults, to have somebody looking over your shoulder, making sure, but taking that team approach and saying we're in this together. I've met some parents who have shared with their children because most of us are on some type of medication, whether it's a regular, and they say, I have to, and they share their own struggles. I have to take my own medication and this is my pill box, or, I have to take this at night and I have to do this every night. I'm not just singling out you. We each have our own regimen that we go through. Sometimes the sharing between the parent and the, young adult, depending on the age, the open and honest conversation might help with that.
And then the foundation has a couple virtual teen meetups and young adult support groups. And I've seen, the teenagers just talking to each other, realizing they're not the only one who has to take medication once, twice a day, that, they're not alone in this. And so I think getting your teen involved with one of those groups would be helpful.
Thank you, Scott. Thank you, Jessica. Really quick before we go on to a side effect question for Dr. Ficker and kind of close up everything. You guys gave great suggestions, but what about a patient, or if you guys have experience of like traveling or being on the go, like how do you remember to take your medication when it's doing that time when you got to travel, or you go somewhere else, or you spend time with family for the holidays? You guys have any advice for patients who may be struggling, who may have a busy travel schedule, or just like going, sleeping somewhere else other than their home?
I would say the years of travel have shown me having something like this to help you keep track, a day of the week. Time zone changes can be a challenge. So if you're used to taking it at a certain time of night, make sure you're adjusting for a time zone if you're in another part of the country or a part of the world. But yes, and also when you're traveling, it might be a good idea not just to take this, but also have your bottle. So if you need a refill or something changes, you have all the information off of your bottle while you're traveling. This would be my biggest tips.
That's really smart. Yeah, not just count out the pills, but your flight could be delayed or whatever. So take all your bottles with you. And then because of the time change, our phones will adapt to different time zones. So if you feel comfortable using those reminders on your phone, that's helpful.
So I don't see any other questions coming in, but I do want to answer. I would like for Dr. Ficker to take a shot at answering Maria's question. Thank you, Maria. But, we talked a lot about side effects of medication, and how do you balance the side effects of seizures and then the side effects of medications? Like how as a provider, how do you or how does someone are able to tell which side effect is coming from where?
Right. And that's sometimes challenging too. If someone's on, if someone is started for the first time on a new medication and there are side effects that develop and continue a few weeks after starting that medication, it's pretty clear that that medication is responsible for those symptoms. And so in that instance, we would look at, working with the patient and in discussing, are these side effects tolerable or intolerable? And if so, if they're intolerable, then we look at switching to a different medication. It gets more complicated if someone's on more than one seizure medication. Is it the combination of medications that's producing those side effects, or is it, one medicine versus the other? It can be challenging. Someone else asked about side effects differing from individual to individual, and there's no question that we see, we have, when these drugs are studied, we get a list of the potential side effects, and they're variable from person to person. So, Mrs. Smith might experience with levetiracetam depressive symptoms, and Mr. Jones does great on levetiracetam. So there are the side effects are not always predictable when you're starting that particular medication. But it's important to have that honest conversation with your provider about what you're experiencing, and is it something that can we improve upon that by making some adjustments in the medication dosing or timing or how you take that medication, or is it a time where we switch to a different medication? And those are discussions that we have every day with our patients who are taking anti-seizure medications.
Perfect. Thank you so much, Dr. Ficker. So it looks like we don't have any other questions coming in. And so I will go to the slide that we said that we would talk about. The Epilepsy Foundation does have this resource. It is our 24/7 helpline, and our staff are ready to help you. We have it in English and Spanish. And again, if you're having concerns about medication adherence or resources or, cost or anything with insurance, you can definitely give us a call here using that number, and we will find you the right resource. But again, and then also in the group chat, there was links for you to find a support group virtually or near you, whether you want to be in person or virtually. We have those options. So definitely take a look and see if there are some support groups that may be also talking about medication adherence, and you can find different resources and different strategies that have worked for other people. Again, your feedback is very, very important. We would love to hear how well this webinar went, if it went well, if you thought it did, other things that you would like to talk about. So there will be an email that will be sent out that you will have a link to take that survey. So please take that survey. I look at those surveys personally, and I make sure that I share those with our team to make sure that the next webinar is even better, and we're actually talking about things that you all want to talk about. So I'm going to end it today. I also again want to thank Dr. Ficker, again, Jessica Scott, to the participants and attendees for your interest and engagement today, this afternoon on Wednesday. And again, thank our partner Azurity for sponsoring this webinar. So thank you all again and have a great rest of your day.
Thank you. Bye-bye.
Bye, everybody.